So joining me live is the new NDIS Minister. She replaced Bill Shorten about a month ago, Amanda Rishworth. Amanda Rishworth, thanks for your time. Let me start with this news I've just revealed. Can you tell us what is the nature of the one-year deal being offered by the PM on foundational support money for the NDIS, and why is it being tied to the hospital agreement?
Well, firstly, I would say it's not new that we are working with the states and territories to develop foundational supports. In fact, I have been working with my counterparts to work out the design of foundational supports, what they might look like and how we might go forward on that. In terms of the agreements with states and territories, I mean, there are a lot of agreements with states and territories that our government's progressing. Certainly the health reform is one of those. NDIS reform is another one of those. So there is a lot of agreements to land with states and territories, and what I've been doing is working very hard to put some meat on the bones about what we would be funding with foundational supports.
Well, you say it's not new. The fact it's a one-year deal is new, isn't it, that you're looking at?
Well, we've been working towards foundational supports for a long time. I'm not privy to the First Minister's negotiations, but I've been working very much with the idea of how do we stand up supports outside the NDIS that are there to support people that may not need the intensity that the NDIS provides. So, you know, the First Ministers will continue to have their discussions, but I'm certainly working on what foundational supports looks like, how do we roll those out, and how do we make a difference outside of the scheme so that there are supports available for people.
Indeed. And do you expect states to be providing these foundational supports by mid-year as envisioned? Are the states fair dinkum about this, or could the deal just collapse?
Well, look, it's never been expected that all the foundational supports would be stood up this year. Indeed, as the review outlined, they will have to be rolled out in a progressive way. But we've had good cooperation with states and territories. Just one example of a system change that we have with South Australia, for example, is what's called the Inklings program. And the idea of that is actually to provide intervention before there is a diagnosis to actually ensure that children are put on a really strong developmental pathway and actually don't need the NDIS, don't actually ever enter the NDIS. So there is already work being done around what these systems look like outside the NDIS, but we'll keep working with the states and territories to start standing these supports up.
And what money are you proposing to give the states to deliver these services, which can act as an NDIS substitute? Is there a danger of just cost shifting from the NDIS, or are there going to be real savings here?
Well, let's be really clear. The NDIS is a joint endeavour by states and territories and the Commonwealth, and they co-govern. But what we're talking about, and the review made it really clear, is that for some people, for some children as well, that may have developmental delay, that they might be served outside of the scheme of lower intensity support. So they don't require the full individualised plan that is provided by the NDIS. And just in the nature of the way the supports will be delivered, the connection, that will be a lower cost. But I have to say, Andrew, when it comes to sustainability of the NDIS, foundational supports are not the only element that goes to sustainability. There is a lot of work we've been doing and will continue to do to improve the sustainability of the scheme and to actually hit that 8% growth target, which we are on track for.
I'm told in terms of saving money through the foundational support, so one example is the federal government would want schools to have a staff speech pathologist each, for example, rather than have, say, 10 private speech pathologists visit schools to see students one-on-one. Is that a good example of what you're trying to achieve here?
Well, I think a good example, I don't want to be so prescriptive because we're still working through, but a good example would be if a child might have some fine motor delay, rather than an individualised plan that has a range of different supports, they might be serviced with, for example, some adaptive technology like some specialised cutlery that helps them with their fine motor skills, and perhaps some periodic OT input, rather than a full individualised plan that gets reassessed and re-put in place every single year. So they are the types of things that we are looking at. How do you provide much more targeted, much more often episodic or periodic interventions that do not require this sort of individualised plan? I don't think anyone accepted that for children with developmental delay, that they would have an individualised plan for a lifetime. That certainly was the vision for the significant and permanent impairment of the scheme. So we've got to work and identify. Things look different in different states, and that's why systems are different in different states, and we will be working with each state and territory about what that looks like and how it might be delivered.
Well, how did we get to the point where something like 35% of people on this scheme have autism? Could there be closer scrutiny of who gets this support? When this scheme was set up, it was for people with significant and permanent disability. There was even an ANU study in 2023 which suggested there were more autism diagnoses in this country, and that could be linked to accessing the NDIS.
Well, look, what the review said, Andrew, was that with the NDIS, the only level of support, I think the review said the only lifeboat in the ocean, of course it has led to people gravitate to get support. That is partly what I said foundational supports are about. It's also partly that there are two pathways in the NDIS. Firstly, the permanent and significant pathway, and then there's the early intervention pathway. And for me, I want to make sure that the early intervention pathway is making a difference, that it is evidence-based, that we are seeing interventions that actually improve the developmental trajectory of a child, so that they don't need to, on an ongoing basis, actually rely on the NDIS. So we need to, of course, the NDIS was never designed that it would be diagnosis driven. It was really about functional capacity and what supports you need. So we need to get back to having a focus on that, and also make sure for those that may need a lower intensity of support, that it's out there in the broader community through different service systems. And that's what we're working to. And quite frankly, it's been really left to drift under the previous government. There wasn't the sustained focus. Now, former Minister Shorten had a sustained focus on this, and I will continue on that.
When Julia Gillard rose in the Parliament to announce this scheme, she said there were more than 400,000 people living with significant and permanent disabilities. And then 13 years later, we have 650,000 participants of the scheme. How many people do you envisage in, say, 3 to 5 years being on this scheme?
Well, look, I don't have those projections, but I have to say what's driving the scheme is, or the costs in the scheme, is not only the number of participants on the scheme. It has been identified that intra-plan inflation also has an impact on the financial or the fiscal elements of the scheme. So while numbers are important, we've got to make sure that eligibility is correct and that it's significant and permanent, and the supports put in place are about supporting people that are reasonable and necessary. It is not just the numbers that are driving the cost here. We had a situation where we've put some new rules in place to be really clear about what's funded and what's not. There were grey areas about what is funded, what was not, and so we were seeing some confusion around that. We've put very clear guidelines now about what should be funded and what shouldn't be funded. We've also put some really clear guidelines about how people manage their budgets and their plans, and also make sure, for example, that there isn't service providers gouging participants. So it's taken a lot of work to look at how we bring these costs down. Just give you an example, 2021-22, when the previous government was in charge, there was a 23% growth in the cost of the scheme. 24-25, we have been able to bring that down to about 12%.
Sure.
This is significant progress we're making on the sustainability of the
still
scheme.
12%, your target's 8%. Let me ask you this, I appreciate your point on the numbers, but Julia Gillard spoke about 400,000. We've now got 650,000. Could you envisage 1 million Australians being on the NDIS? Because it looks like we're headed that way.
Well, I don't think that's right to characterise the trajectory like that. I'll just give you an example. Recently, the numbers were revised of the number of Australians living with disability in this country, and it's 5.5 million people. So if we look at the numbers that are on the NDIS, it is certainly not all people living with disability in Australia. And of course, that 5.5 million had been revised up from over 4.5 million. So we are seeing the trajectory of people reporting disability increase in this country across the board. Not all of them are on the NDIS. In fact, only a small proportion of people are getting support from the NDIS. And that's why we've got to be continuing to work hard to look at what other supports we can give people to make sure that they don't need necessarily the NDIS but can get support elsewhere.